Well, hello, everyone. This is Paul Wolanski. I am the Assistant Dean for Development and Alumni Relations at the Case Western Reserve University School of Dental Medicine. We want to thank everyone for showing up this evening. We have got a really wonderful presentation for you. Joining us tonight is Dr. Ace Goerig. He is our 2014 Distinguished Alumnus from the Case Western Reserve School of Dental Medicine. Very well-known speaker nationally. We're so delighted to have him here. Before he begins, I just want to give you a few updates. First off, I want to let you know that coming up on June 12th, we'll be doing our next continuing education program as well. That will be the program with Dr. Raymond Ruiz on reconstruction of cleft lip and palate, infancy through adolescence. So if you join us at case.edu/dental, you'll be able to register for that immediately. That registration is up now. So I am going to turn it over now to Dr. Goerig. You are in for a treat if you've never heard him speak. He is truly outstanding, and it is really our pleasure to welcome him tonight. Take it away, Dr. Goerig, joining us from Olympia, Washington.
Good. Thank you so much. It's just a real pleasure to be out here. And it's great to be able to continue to be treating patients at 75 years old and still having fun at it. But I'm going to talk a little bit about, as an endodontist, we have been in treating patients, throughout this whole pandemic, and some of the things we've done and learned on making things a lot more efficient. I'm going to go ahead and move to my slide program. This was actually my school when I entered there. This was Case Western Reserve era 1967. I just want to share how great it was in those days. We used to have chairs like this, and I'm sure we were all masked, gloved, and we're ready to go. Although we brought our big boxes in, and you could imagine all the screaming that was happening in that room with 120 dental chairs. Fortunately, we built the new school, and then 2 years later, I moved into the new school, which is now actually the old school. So things have come a long way, and we have seen a lot during that time, including different pandemics. Every year has been a flu epidemic, and many people have died in those things, and yet very rarely has any of us ever been sick with the flu, which I have never been sick with the flu. But for me, this was going to be my best year ever. And for many of you, everything was going great. The economy was going great. And then all of a sudden, this gigantic tsunami came over us, and this pandemic that has happened to us. Now, there's a lot of ways you can do this. You can just let it engulf you, or you can basically surf it. And actually, what I want to talk about tonight is how do we surf the tsunami and have some fun at it? My God, I mean, what a great wave to surf. And actually, I think we're all going to be fine. We're all going to do great. But we have to create the systems in our office so our patients feel comfortable, they feel safe coming back. And I think it's going to be a lot easier for us to get back than we probably think. Although I've heard that in Ohio, actually offices opened about 2 weeks ago, and you are treating patients normally. So where we stand now, most dental offices, a lot of dental offices around the country, we just opened up in the state of Washington this Monday. But during that time, we've handled emergencies. We've kept people away from the hospital ERs. Initially, when that first happened, I pretty much put everybody on unemployment, and so that they could get their benefits. Each state was different. It was amazing. Arizona would give a maximum of 240 per week. Washington, actually, we were giving like 700 per week plus the extra 600. Now, I don't know why people even come back. But there was a reduction in the general dentist practice, about 98% in patient flow and revenues, which really has affected all of us. In endodontics, on an average, because I coach endodontists around the country and I see all their numbers, I mean, we were reduced by somewhere between 60 and 80% in our in the patient flow and revenue. So we had quite a loss. So doctors are now reopening. and we've lost the income and overhead for the past 2 months. Many need to change their mindset to get back to full capacity. And my job during this time is to help you rechange your mindset and share these ideas with your team members so that they can be excited about getting back. Now, initially, you're going to have this pinned up demand, all those patients that you had scheduled. And I would think half of them are very excited about getting back to dentistry. The other half might be fearful and may even push it out. So initially, we'll talk about how do we handle and how we create productivity. Most focus needs to be done initially with the patients you have on real good, high production procedures, which we are able to do because we have all these patients we can select from and put them in those procedures. As endodontists, the cases that I would treated over this pandemic timeframe, I've sent a list out to all my referring doctors. These were the patients that need crowns, just to kind of get them started. Many patients and team members are going to be apprehensive. They're going to be nervous about contracting the virus. The patients are a little fear of avoiding non-essential expenses. Many have lost their dental insurance, and there's going to be a scarcity out there also. Economics, in the last recession, there was a 13% downturn in 2008, 2009. But then they did not really have the real fear factor that our patients have. I do believe that they will, as soon as patients start getting back, just like when we went back into the office, we're getting back to the feeling of normal. Once we get a patient into the operatory, into our office, and show them the things that keep them safe and give them an incredible experience, I think we're going to do actually very well. So, what is the back to normal, or is this the new normal? And if we reopen, will there be a resurgence? These are things we don't know. If there's going to be a vaccine soon, most people feel it won't be until next year. Is the compromise, will it be an epidemic or like a seasonal flu? And actually, the last coronavirus, it pretty much died out in the, by the end of May and June, which was, made it much more, was a lot easier to kind of get back. And we don't know if infectious control procedures that we've done before work, and by the way, they do. And then how do we schedule our patients so it flows, but we kind of protect them from not being together. And I'm going to get into that pretty well in this procedure and this presentation. So the initial challenges are, okay, we're bringing patients back. How do we, our team back, how do we qualify for their PP loan forgiveness? I'm going to go through that. Infectious control and clinical care, do we have enough PPE? It's really important when you come back, if you haven't been back fully, is to sit down with your team, role play every aspect of the procedures. For example, how do we ask, the patients questions about, have they been sick? Or is anyone in your family, have the virus? Those sort of things. How do we remind them how safe we're going to be? And we go through, practicing that. How do we bring them in so just everything flows? And role playing is important. And then other challenges is the mindset and fear of the patient. That's why we're going to do other things to give the patient the perception that we are truly safe. And we're going to discuss those things. The big picture, of course, is we need to stay connected with our patients. I know you're bringing them back now. Actually, through this pandemic, it would have been good to connect with your patients one-on-one, or even text them, or send them out things that remind them that we're going to be opening, and these are the things we're doing to protect you. And it's real important to keep in connection with patients, because actually they're family in reality for the general practitioner. And then how practice can quickly recover. As I mentioned before, we want to maximize, the productivity. And so there's really no gaps in our scheduling. And then we need to catch up on these booked out patients. And as I said, create a schedule that is for high productivity. And then how are we going to recover a strategy? So these things I'm going to address in this presentation. So bringing back our employees and getting the PPP loan forgiven. So when do we bring employees back? We bring them back as when we need them. And I'll just tell you how we worked in our office. And like I said, we were reduced to about 40% or 30 to 40% of our normal production. So we didn't need everyone to come back. So I put the senior people on unemployment. They were making just almost as much as I was paying them normally. Those team members that were junior and really hadn't created a lot of money built up in their unemployment benefits, I brought them back pretty much full time and kept our other employees out until we were able to get the payroll protection plan loan. Once I got that, then basically at the beginning of this month, I brought everyone back to full-time, even though they might be working 25 or 30 hours. We don't need extra people around, but they will be paid through those 8 weeks period. And the way I figured that out was in January, what was their average pay per month, and I divided by 4 weeks, and we pretty much give them that payroll and to make sure everyone that has enough time out. Now, also during this time, we may have them do different continuing education. I mean, I'm sure that the Dental Society, the State Society has different programs that they can do on their part-time. Now, I do have 1 or 2 employees that have problems with childcare and aren't able to come back, and actually I've kept those people on unemployment. The key of bringing people back, your team back full-time, is to ensure that we don't waste their unemployment weeks. I mean, if you bring them back part-time, keep them partially on unemployment, they lose that week. And so in our state, and every state's different, they have 13 weeks of unemployment. I think it's been extended by the government, by the way. So far they have used like 5 weeks of unemployment, and I can go ahead and bring them back for 8 weeks. And if things get slow, I can actually put them back on unemployment because they'll have these 8 weeks to work out, so that until we get back to full strength. So that was what we're doing. And there's some specifics about this PPP loan, which I will get to. But we all, as doctors, we feel an obligation to take care of our team. And I had a choice. Of course, I could keep paying them out of my pocket, but not use them. But that's what unemployment is for. That's why we paid into unemployment. And so we're just getting the benefits that we've already paid for. And we may not know, when the practice will be really getting back to the same level or full strength. These are things we have to consider. To have a PPP loan, which requires me to bring back the team, which we've talked about. And even if I bring back the team, I may not have enough for them to do. So like I said, what I did was I bring them back part-time, but pay them full-time through this. And that included all bonuses before. Now let's look at from the team perspective. In our state, I have, when they were unemployed, I mean, they were getting like, about $1,300 a week on unemployment. And so, but my team was really happy to kind of get back, and as long as they knew they were going to be well taken care of. Some people cannot come back because they have dependents and other, they have to provide care, education, and many of your employees are having that experience. So that is a decision whether you keep them on unemployment or bring them back full-time, or pay them full-time and keep them working part-time. And then there are going to be a few that just don't want to come back. Now, they're going to be very fearful. Some are really fearful. The hygienists, for example, are fearful. I think that's overblown. I think the society gets carried away with that. But you're going to have those that are committed to come back and feel that they're going to be safe. And I'm going to give you some examples of things you can do to make them actually feel safe to bring them back in this program. And but there will be people that will never feel comfortable. And once you've determined that, then you basically just, get a commitment to them that they aren't going to come back, get a signature, and then you're able to bring back or hire new people if you need to. And that signature is important because when loan forgiveness comes to play, we will talk about that. So this is the strategy when we talk about the PPP loan. We all know that it's over an 8-week period, and I guess they even say 56 days, counting it. And that 8 week actually begins when the money is put into your account. So it's important to keep good record keeping. During that time, some people would say, well, I can open up another account and put the money in there and I can keep track of it. Actually, there's not that much to keep track of, right? I mean, there's payroll, there's healthcare, any other expenses that, like, for example, the healthcare that you send out, you keep the bill. Payroll is pretty simple. You look at the QuickBooks, it's all pretty well calculated. And so it's fairly simple to keep track of this, but basically you just need to talk to your bookkeeper or your CPA and have him go through the process of keeping track. Now, if you're going to go ahead and pay them what their normal salary was, it's pretty easy to understand what they're going to be getting, and you can plan that out ahead of time. Now, forgiveness qualification, 75% of the money needs to be actually spent on payroll, which also includes healthcare. It does not include the healthcare expense for the doctor, okay? But for everybody else. And then 25% of the other costs can be for rent, utilities, phone, maybe computer, and things like that. Now, you could maybe not spend, let's say you have $100,000, but you basically only spend a total of, let's say, $80,000, and the amount of money that you spent, you may not be able to give maybe 75% toward payroll. Well, you don't lose the forgiveness just because, you only spent 65% on payroll. But it does, you'll get a little reduction, and you'll be able to save actually a majority be forgiven. But this is something you sit down with your CPA and they can talk about these things. Individual salary rates should not be reduced more than 25% also. That's another thing that as pre-pandemic, and that's another qualification. But the grace period goes till June 30th. You have to have 100% restoration of full-time employee headcount actually by that date, or maybe by the end of your 8 weeks. And to do that, that doesn't mean, it means you can bring back maybe 60%, 80%, but at the last week, it has to be about the same as the average number of employees, like from February 15, 2019 through June, or maybe January 1st through February 29th. Basically, how many employees did you have? You had 8. That's full-time employee headcount, but you can modify that, and it does not have to be the same people. So let's just get to sort of specifics. Number one, this loan money really becomes a grant and becomes free money. It's a good deal, okay? And we're able to use it. Any unspent funds, I mean, you could actually turn them into a 1% loan. Personally, I just don't like borrowing money from anybody, and so you could return the funds. The full-time employees that you count, the number of count, let's say it's 8, they don't have to be the same people. You could bring back even family members if they know how to assist or do something that works in your practice, or work at the front to bring you up to full-time employees. Now, as an owner employer, they say, it's maxed at 100,000. In reality, it's maxed at 52 weeks divided by 8 weeks, which means the max that you're going to be able to write off in those 2 months for yourself is $15,385. So you divide that over 2 months and or week, whatever you want. But this also includes your health insurance and your retirement in that amount of money that can be forgiven. Now, a lot of you, like myself, were able to get the IDL grant. And if, let's say, you were able, they gave you the loan, the PPP loan of $100,000, and you use $100,000, basically, and you got $10,000 from the EIDL grant, which is free money, they're really only going to be able to write off $90,000 of that forgiven. But if, for example, you spend on qualified things like employees and other things, $110,000 out of the 100, then basically you can write off the 100,000 because they're going to discount basically 10,000 of it. So that's sort of how that works. Now, also, headcount number can be reduced. Let's say if a full-time employee refuses to come back for anything. That's why it's important to qualify that and maybe send out even an email to all employees welcoming them back. If you're not intend to come back, basically state that and give me an email back saying you're not, because you need documentation. So let's say one employee is very fearful about coming back, and I knew one hygienist that just, I'm quitting completely. And then basically, if you had eight full-time employees, now really all you really need to meet the requirement is 7. Okay, so that's sort of how that works. And that's why we want to get that in writing from that employee. Now, as I discussed before, the reason I bring them back full-time is so that I can keep, I can keep some of my people on unemployment, but definitely when I bring them back, I can keep some unemployment for maybe, let's say 6 weeks, but then at the last week, I can bring them back so they're full-time employees. You can pay your full salary and maybe keep your people on part-time, as I mentioned before. But during that time when they're home, you can have them watch different training videos. All-Star Dental Academy has a great program that they have. It's fairly inexpensive per month that you can sign up for. And your people can actually be trained and tested on verbal skills and on how we communicate with team players, communicate with patients and other things there. It's a great program, and I'm going to give you a link to that. When you take your team off unemployment, you save their unused unemployment, as I talked to before. But our goal, I think, would be able to keep our office open 5 days a week. When employees have been off work, I mean, your patients, and they come back, they're going to take any job they can and make any amount of money they can. And so it may affect them coming in because they don't want to, take off time from work. So that's something to look at. Now, this whole thing is subject to the SBA rules, litigation, and your state employment rules. So I'm not an expert at this. That's why you have a CPA. But I have done a lot of research in the area, and the rules are always changing. That's the problem. We're getting pretty close, though, which is good. I hope that kind of gives that. I have also created this PPP loan forgiveness calculator. It's just pretty simple. It's just an Excel sheet. You put in, the loan that you were given, and you put in the salary every week of your employees, your health benefits, the retirement plan, any state and local payroll taxes, and this all qualifies for the part of the payroll cost. The other is rent, utilities, and phone, water, things like that. Just as long as you have proof that you've paid them, and this will give you where you're at, 75% or whatever that you have spent. And it's pretty simple. The only things that your rent, you'll basically what you're paying your employees. You could even actually fill this out ahead of time and have a pretty good feel where you're going to be. but I'm going to go ahead and provide this for those that are here at the meeting, so that it might help you in your planning process. But again, that's why you have a CPA or your bookkeeper to help you through this process. So we're going to check with the team. Remember, if they don't want to return, you can hire a replacement, okay? We have to document that, as we talked about. In some states, it's required that if a person does not want to come back, they have to be, the state has to be reported that they don't want to come back. Also, we want to remind team members that that extra $600 that they were getting does stop on July 31st of this year. So, which may be an incentive to have them come back, because there are going to be a lot of people that will be out of work and may not be able to find work. But that's actually a great opportunity for us to find the right people. If also, you need to look at your employees. It's a great opportunity. Right now, if you're slower, this is a great time to let people go, free up their future, because now's the opportunity to really, get the people that you want, because they will be out there. They will be hiring. I know I was looking for team members in my office before all this came out, and it took a long time to find the right employee, because everyone was busy. And we will get back to that, by the way. We need to be able to create a safe, productive, and financially sound environment in our office to make our patients feel comfortable and make our team feel comfortable. So let's talk about PPE and infection control. Now, we of course want to reduce the risk of transmission to our patients, our team, and doctor. And but the basics, we need to eliminate, number one, symptomatic people, whether it's your team members or patients that we call over the phone. What is interesting, when we ask the patient, those different questions about, have you been sick? Have you run a fever? Or have you traveled out of country? Have you, those basic questions. You want to tell the ladies at the front who are calling these patients in to always begin that phrase with, the doctor wanted to be asked these following questions for your safety and for our team safety, versus I need to ask you these questions. But when it comes from the doctor, it's much more accepted by the patients, okay? Patients and team are screened at the door, and it's amazing. We will ask them the same questions, and it can be different. Some people say, "Oh yeah, my husband has COVID. I forgot to tell you," So we'll play the game, and we'll probably send the patient home and have them back when everything's better at their home. But in reality, you never know who's going to have this, and because it is a disease that you really can't tell, and sometimes they have no symptoms at all. So we talked about for the team, masks, face shields, which are fairly new, and some people use face shields, gloves and gowns, and normally it's smocks we normally wear. Occasionally I will wear a gown, but during this initial time, we all wear a gown, and disposable one. But basically, because they're so short, we wear them all day long. And there are different things that people do in their offices. This is one example where they put up kind of like a big plexiglass shield at the front, and they basically stay well until they're brought up to the front. But in our office, and this is what we have been doing to make people feel more comfortable, and this is my office, is that we put in more of these plastic chairs now. And we'll talk about this, but really we don't really invite guests, other companions. We recommend they stay in the car, at least through this initial process. And so when they come in, oh, by the way, a little thing up here. This is a TV screen, gigantic TV screen. Now in the wintertime, we put a fireplace in there. It just warms up the place. And actually we'll have a lot of, rivers or just beautiful scenes that people can watch when they come into our office. So I just love that part. So a patient comes into the office, and then they look over here. This door is open. I mean, it's usually closed, and but during this whole pandemic time, we leave it open so we don't have to keep, wiping down the handles and things like that. This is the Air Doctor Pro. It is just a filtration of air. They were like $623. There was a discount of $300 on them. I'm going to give you the link to that so that if you want to have something. Now this, remember, it's all about perception. And I do believe this filters the air. It has HEPA filters for viruses. And it's good for about 2,200 square feet. We have one here, and we also have one in the back area, in the treatment room area. And so my dental assistant is ready. They bring the patient back here. And when they come in, we have like these little face shields or little shields. It's droplets that you're concerned about just to make our team feel more comfortable. But in our office, and I'll explain how, hardly anyone at the front really even gets to connect except over the phone with patients. But we have a hand sanitizer at that time. They're offered a mask if they do not have one, and then the assistant does their temperature here, and they're brought right back to the operatory. Okay. So, and then I will go through that process in a minute, exactly how we carry patients from the front through the operatory. Now, there's a big deal about these N95 masks as compared to level 3 masks. What you're going to find, and I'm going to provide you information that can make you feel good that the level 3 is actually probably even better than the N95. And there have been studies in the past where they checked flu epidemics and people that wore N95 masks compared to regular surgical masks like the level 3. Really, there was no difference in contracting the viruses. And there have been like, 2, 3, 4 studies that have verified that. You have to understand that the level 3, as far as the microns go, that the virus is equal in both N95 and level 3. But if you've worn a level N95 mask, which I have, and many of my friends have, you can find it's very, it's hard to breathe. I mean, you get a rash sometimes. And also, when you're buying the KN, the Chinese N95 mask or Korean, many of these that people went out on the market to buy and overpaid were really just defective. And many of the N95 masks are actually overpriced and they're difficult to get. And I don't know who ever came up with this, why N95 was so important if they would have just done the research. But there is no difference in the filtration for the coronavirus. And as I said, the N95 is more difficult to breathe through, to make it through the day. And but the level 3, especially for the team members, and a face cell is shown equally effective. And actually, these are much more available. So also, I'm going to give you a link where you can modify the level 3 mask so it becomes completely tight around your face. Okay, it's just a modification in the strings. There's a little video. It takes, it's a 1.5 minute video that I'll share with you. And all of this I'm going to provide in kind of like a follow-up email. Well, I'll just give it to, to Paul, and then he'll make sure it gets out to you guys. Just recently on May 12th, this Dr. MARKUS, he was a German dentist and actually physician, but he was basically an oral surgeon. And he provided for the Washington State Academy of General Dentists this great presentation that actually begins at 14 minutes and 12 seconds after his introduction. And he goes on for a bit longer, answers a lot of questions at the end, but for about 45 minutes, he hits certain key things that I think every team member needs to hear to make them feel comfortable getting back into what we're doing. And the link will also be in that handout. But these are some of the things, the key points he talks about. He says that droplets are the real cause of them, mostly the real cause of infection, because they're large enough and have enough infected material and virus in them versus aerosol. Aerosol is not as a problem as the droplets. The second thing he shows in this program is how our high-speed evacuation systems are highly effective in removing both droplets and aerosols. And so with this, very little ever gets out. And besides, you are masked, okay? And then he also believes in level 3 surgical mask versus the N95, and he feels there's really no difference in between. You can listen to him, and I will give you some research that you can look at to make yourself feel a little bit more comfortable. What was interesting is that he was saying the 94,000 German dentists from Germany had remained open through this whole process and did complete care. And he said that there is yet a case that has been reported among the doctors or team members that contracted a virus through the office. And that is, something to consider. And it's amazing how the majority of us, when we wear a mask and we have this type of protection, we just don't get sick. And that's a reason, especially even during the flu seasons. And so basically what we have done in the past, the protection we've carried in the past, is actually probably fairly sufficient. And that was what he came to. Unless you're treating a patient that has an active case of the virus. And then he probably put an N95 mask on, probably a face shield, and treat the patient. And it's amazing how many times we're probably treating patients that do have it, that have no indications they have it, and I think we'll probably be fine. And so far, I have not heard of any cases of COVID that has been reported among any dentist and team that they have contracted during treatment of patients in the office. I know there are dentists that have probably contracted it, but it probably has not been in the office because they hadn't been really back to work yet, or either they had taken a trip to Spain or someplace, or Italy, and contracted it, the disease. And just a reminder that the CDC estimated that in the United States in 2007 to 2018 season, there was about 48 million people that got the flu. 22 million actually went to their care provider, and of that, maybe 959,000 were hospitalized. In that, like almost 80,000 were death just from the flu. And we have been working with these numbers throughout our career. Like I remember doing my first root canal surgery 50 years ago. And by the way, then we wore no mask. We did not have gloves, except maybe if we went into oral surgery. We basically wore ties and shirts, and things haven't changed a lot. And it was basically the AIDS epidemic that the dentist who purposely infected patients to get attention to the AIDS virus was when we started wearing our gloves, and that was in the 80s, and sometimes masks. And a lot of places to get face shields. There's this face shield here. It's kind of interesting. It covers really well. It's like a $3 face shield. I just ordered some just to see how they were. Actually got them in a week. But you could also go to Amazon. When I first started looking for face shields, there are like 1 or 2 types. And now there's probably about 20 or 25 types available that work, that you're able to get. And this is, remember, a couple things. Make your team feel safe, and make your patients realize that you're doing the most to protect them. It's all about perception. This is kind of an interesting, I had this one doctor, she said, I've just found it so much better just to turn the face shield upside down, because the splatter, if it's going to be doing, is coming up this way, not under my face shield. So I thought, well, kind of an interesting concept. So where do we get, the N95s? I think you're going to find level 3s masks much more available through our supply chain, which I had been ordering a lot. So when my general practitioner came to work, I just give him boxes of some of these level 3 masks. And one of my doctors had recommended that every every county has an emergency management section. So just go under your county, like Cuyahoga County Emergency Management, call them up and say you're a dentist and you would like to get some, masks or gowns or whatever. And I called my local management up and said, sure. And so I drove over there, got 50 N95 masks. And these N95 masks actually can be used over and over again if you want. Once you use them through the day, you can put them in a bag and hold them for 4 days. And by then the virus is gone. You could use ultraviolet light to kind of go over the mask, to sterilize the mask. There are other areas. One of my general dentists says that you give the county or just go to this one place, you give them the mask, then they bring them back sterilized. So there are a lot of things out there. In California, my friend went there and got 100 masks. I had another person in another state where they went not only to get masks, they got gowns. And all of these were free. Okay. Now, some states may charge you, but the ones that we have worked with and I've talked to, basically, they just give you the PPE. So it's a thought. Now, this section here, I'm in a study group, a mastermind group with many general dentists. And the hygienists who have been back to work, and the hygienist had recommended, or I've seen this, and this is just a suction that kind of, spreads out and grabs all the aerosol that comes out of mouth when the hygienists are doing their cleanings. And the hygienists that have used this have reported they really like it. So I'll throw that out there. This is the you'll get the link to where you can purchase this. This is just another type of device that a patient, they can have a mirror attached to a high evac suction also. Okay. And so just different ideas. Now, another thing that has come out among some of my doctors that I work with is this idea of hypochlorous acid, which is a fog or a mist. And basically, the way it works, you take kosher salt, put it in water, and put it in this little device, and you create hypochlorous acid, which is just very inert, but it does kill the viruses. And you go through maybe at the end of the day or maybe at the end of the week, and you spray or mist your room. And that usually will get rid of most things. These are used on airplanes, and it's also used on rapid transit. Now you can buy this fogger here on Amazon for around $250, and you might get it in, June or July. And this fogger here, this Ride Boy fogger, if you went to, Home Depot, it would be $99, but fortunately I didn't find it there. So I went on eBay and paid $365 for it. I love the, what the heck. So I have not used this. I have people I've worked with who use it, and they feel more secure with this. But this is also about perception, right? Protecting our team, protecting our patients. And it may be just this thing that makes people feel more comfortable coming back to work. I probably won't be using it, but I'm going to give it a try at least once. Okay. I like this Air Doctor. This, I showed you that, earlier on, but it does filter it has a HEPA filter on it, and it's just, and it does filter the air. And it's very quiet. You don't even hear it running. And it tells you when to change filters, which actually you're supposed to be there for, 6 months or so. Some people have come up with the idea of using ultraviolet light to sterilize things such as your mask. I wouldn't do it with, when I had it on my face, of course, but, or other things that you feel like you'd like a rapid sterilization. I would look into it. It's a thought. And so we'll look at that. Okay, so here's what happens. with patients coming in. And also there is a possibility of teledentistry if a patient has a problem, and you can actually charge for this, and more people are doing teledentistry in dentistry. We haven't really done it as much in endo because I have to actually see the tooth to see if it's cracked or whatever to do this, but it is a way of thinning out the herd of patients that just want to talk quickly, and actually you can, like I said, bill for that. But first, in our office, we call the patient up, tell them they're coming back. Remember, we use the term, the doctor wants me to ask you this question, or the doctor would want me to make an appointment for you. When the doctor says it, they're more open to the possibility of following instructions. And then we have just created a lot of great registration forms, and ours is fairly simple. It's basically the medical history and a basic registration form that we have. And it's a form that actually they go to the website and they can sign it online, and it's put into this website's, the websites I use are PBHS, which is the provider of us, and they work with a lot of dentists around the country. And it's put into a folder when we go into the folder and pull it out, because remember, almost all the patients that are coming in are new and have not done the registration form. But we would like them, or if you need to update their medical history, have them do the forms before they come in. It just saves time. And when the patient arrives alone, basically, we would recommend that they, the person that drove them or their companion stay in the car, except for a few instances. For example, a child that's going to be treated and they need their parents there. Or I just had a patient that came in, and she was basically from Russia, and her husband is also Russian, and he was the one that translated, which I sort of needed there. Okay, and we have actually a little seat chair in the in our operatories that they can sit down. I'd rather have them there or in their own car. And then, of course, as shown before, we have our dental assistant that's masked, gowned, has gloves on. And then we provide hand sanitizers. We do temperature. There is another idea too, the oximeter, which you can actually get on eBay. I've ordered it. It's been a long time coming, although I have one for my conscious sedation patients. Because really, they may not have symptoms, but when normal, your oxygen level is like 98%, and you put that on their finger, and it reads like 75%, you may be concerned that there might be something going on. And it's just another test if you feel you're thinking about that. And then we give them a disposable mask, a level 1 mask, that they can go back to the operatory. And so they really don't even really talk with the ladies at the front. Now, on the phone they have, and we've already gone over fees and what was necessary. And so that the assistant escorts them back to the operatory. During that time, if they have not filled out their online forms, then we have them complete them there. Some people recommend a rinse of 1.5% hydrogen peroxide, which is basically peroxol that you can buy, and let for a minute. It's just another, you just have them rinse it out of a cup, and you just have them spit it into the cup, and then you dispose it in the sink, which actually is supposed to clear any viruses in the mouth and the throat. So we review any infection control precautions, like we want to remind them of the things that we're doing to keep them safe. And then the patient is interviewed by my dental assistant, and now, of course, I'm doing root canals, and we take the necessary x-rays. I arrive into the room, I'm masked and gowned, and I always like to don my new gloves in front of the patient to let them know that these are brand new gloves. I'll do the diagnostic test, and I will, if treatment is needed, I will anesthetize the patient. Now, here is something that a lot of doctors waste time on, okay? A lot of times we may move to another room, do a check, but we let that anesthetic sit for 15, 20 minutes. In reality, all that anesthetic has to sit for is about 2 to 3 minutes. Once the anesthetic is done, you could sit there with the patient, talk to the patient, and then like I say, stay in the room. Then I'll use like a Stabident if it's on the lower, almost always if it's a vital case, to do root canal. Or you just take a regular syringe with a 30 gauge needle and lidocaine 2%, and do a PDL injection. The way the PDL injection is done, it's to the distal of the tooth, both buccal and lingual, and they push down. Okay, and then you take your hand and you push the pressure there. They will be numbed. I mean, normally just the regular anesthetic, but if there is any issue about them not getting numb, it's a very effective way to get people numb. Now, in endodontics, we always use the rubber dam. And actually, I like the rubber dam that sort of, I put it in so it sort of covers the nose a little bit. So I'm a little bit more protection there. And I think in restorative, I mean, you can do slit dams where you put a clamp on and it goes all the way up to the deal to do your restorative. I've even had some of my doctors do apical surgery with the rubber dam on it, and it can be done. So it is just another way of reducing aerosol and other things that come out of the mouth, okay, the droplets. And so once we complete treatment, we take the final x-ray, and what we do here, in endodontics, we like to try to do everything in one appointment. And my recommendation, I think all your root canals, if you can do it, learn to do it in one appointment. Basically do the buildup at the same time and cut the crown prep and give yourself enough time to do it. That's effective and that's profitable. I have one of my best referrals that sends me 100 cases over a year. And he says the greatest enemy of the general dentist is unpredictability. And endodontics for him is. And so what he does, he says, I'll take any straightforward tooth, and that I can go ahead and complete the tooth. And I trained him in endodontics. He was one of my residents in the Army, and he's very good at it. And then if I can do a build-up and a crown prep, that's very profitable for me. So, so then once the appointment is completed, the assistant takes the treatment slip, basically what we did, all the stuff we did, we bring up to front, they calculate it, and they say, this is what the patient owes. The assistant comes back, presents it to the patient, and says, your fee for today will be this. Is that check, credit card, or cash? And then the assistant brings the credit card up or the check to the front, process it. And then once the patient is done, we give the patient their mask if they have it on, and we bring them and escort them to the front and just thank them for being such a great patient and appreciate them for coming into our office. Okay. And at all times, we try to resist, crossing paths. So, and then, currently what we're doing, everything the patient touched, or whatever, for example, when they sign the form, we have pins with their name on. We just say, go ahead and keep the pin, And but this will change. I do believe that once people start coming back on a routine case, we're going to kind of go back to the way things are. And I do believe that if your team, you role play, moving patients in and out, so not too many people are going over or spreading between different chairs, I think we can kind of get back to normal. And initially, though, we want to be concerned to let the patients feel that everything is safe in our office. Scheduling is a big thing. The idea of focusing on one patient at a time, when you get in there, you do your prep, less chance of going back and forth, having to change gloves and things like that. We limit transition between, the deal. If I'm going to go ahead and do an evaluation with the hygienist, for example, which I don't do, but I know this way it works, is that I will make sure that other patients completely treated. Remember, one of the best things that you can do is get your anesthetic technique down so that you don't have to really leave the room, and you can actually begin, because I've been doing this, and within 2 to 3 minutes, I'm able to start the treatment. And that's to do root canal treatment, which is a lot deeper than most of your preparations. And then we have to give them time to sterilize and clean up the room, but we're not doing much different. And the ladies at the front are sort of responsible for the restrooms. If it's used, it's amazing. Patients come in, the first thing said, "Can I use your restroom?" Okay, great. But we need to keep it clean and look like, they should really actually be checked pretty much after every patient, I think. Minimal seating in the reception area, which we talked about. I think we sort of need to get back to a schedule before. Initially, when you're starting out, you're going to be modifying your schedule so you feel comfortable. But in reality, you flowed well in the past. And it's just a matter of remodifying your schedule. Scheduling is really important. I've been a dental coach for endodontists for almost 25 years. This is the big thing. This is what they always are poor on. And maybe the gift that you are going to get out of this pandemic is that you're going to actually hire a coach to come in and show you how to schedule productivity properly. And I'm going to give you a few recommendations. It won't be me, because unless you're an endodontist, then I'd be glad to work with you. And then, of course, managing hygiene, because a lot of hygienists, it's gone through the whole country. They are fearful because of the aerosol. But in reality, it's not the aerosol. That's why I want every one of your team members to watch that presentation by the German dentist to help them feel much more comfortable of what they're doing. But you have the high vac suction, which we talked about. Really, in the old days, we did hand scaling. There's really not too much aerosol associated with hand scaling, and then basically polishing the teeth. Okay, you don't need the ultrasonics. And if your assistant doesn't want to come back, or your hygienist doesn't want to come back, you as the doctor can hand scale. Probably it'd take you about 10 to 15 minutes, and then you have your assistant do the polishing. So, but we have to do the things to make our hygienists, because they're a very valuable portion of our team. They're the ones that sell dentistry better than the doctor. And so whatever it takes to create that safety, whether it takes the fogging or whatever to make people feel comfortable, or that little suction device that I showed you, let's get it, move it forward. But patients are fearful. 71% of patients are uncomfortable seeing a dentist. This was just a poll, and maybe only 54% felt comfortable visiting the office even for emergency. But it is all about perception. So certain things to help patients feel safe. Team members must first feel safe if they're going to feel safe. If you have a team member that is nervous and afraid, they don't belong in that office, And it's like the patient saying, "Aren't you nervous?" "Hell yes, I'm nervous. I'm scared to hell. I don't know why I'm even here." Now, that doesn't really work, okay? But we have to remind people how safe they are. So we have to look at everything that the patient's perspective and the mindset. So we don't treat patients that are infected. This is, and then we have to explain to them why our office is safe. And I'm going to give you a list of things that we share with our patients. Develop great verbal skills, so everything is seamless, role play, timing. And it would be actually great to have a coach go through this with you. Tell patients on the phone about online forms, how to arrive at our office, what to expect. And you're the person that drives need to be in the car for it and stay with you in the car. Welcome them into the office. Bring them back to the chair, and show minimum contact with other people. Remember, teach your team never to use the word policy. Well, our policy is that this is what you have to do. That's a death word as far as trying to keep patients, What they need to say, "We're really looking forward to seeing you," And the doctor wants me to do this and asked you about this. Some offices greet patients even in the parking lot. But and then we explain the benefits, everything in the benefit, why we ask questions, why we take certain x-rays. Everything is in their benefits. And that's one of the great things with All-Star Dental Academy, that their training, I think, is excellent. I've been a member of them for the past 5 years, and I keep updating my my people at the front end, actually, they're very efficient, but we can always learn. This is just a list that I will also pass out to you, why we are going to keep you safe. You know, like we screen everyone before the appointment, including the team members. We check temperatures, we hand sanitize everyone, and so on and so on. And you'll be able to read that. Teledentistry is a thought. I think over time, I know people will be talking about that, but I'm not an expert, so I won't. So factors, so you can see I gave this actually for my endodontic group, and I haven't changed the slides yet. Okay, but it's all the same. Income will you know, there will be deficit for the last 2 months. The speed in which people will come back, you know, be slower. Scarcity mindset. I'm just going to zip through this. Many patients will be nervous. We talked about that. So not all businesses, it won't be as, you know, business as normal. And this really depends on your mindset. What I want to do, and I hope I've done here during this procedure, is to say what we have done in the past has worked. No one of us have really gotten really sick. And we've fought and been in environments where there's been flu epidemics and things like this. And how many of we've always gone to the office, and because of our masks, because of our gloves, we have been safe. Now we add face shields. Now we add more gowns. So we're even going to be safer. We need to look at this, and what's interesting is that when we really look at our office, we really can see some of the weaknesses that we have and we need to fix. But you can pick however you want. Personally, I'll pick the first one, full recovery this year. And it may be sooner than we think. And that's the mindset that we have. Some people say, oh my God, I mean, you know, we're only going to get there. We're not even get to full recovery at the end of the year. Some, oh my God, it's going to take 2 years to go through it until we get a vaccine. And so, oh, we'll never recover. There were going to be dental offices that don't make it. I mean, especially those that were on the fringe anyway. But you all have the ability, and it's just an attitude and a mindset for you to do this. So recovering quickly is maximize your dental procedures, get a great template scheduling. You won't talk, tighten up your systems, invest in yourself, which really means the coaching. All-Star Dental Academy is not that expensive. I think it's like $300 a month or something, but and this time's a great time to go on board and get trained. Find a good coach. They also have coaches there. Invest in marketing. This is going to be a great opportunity during this recession. And I know you hesitate to use money, but I mean, marketing will be important, especially even on your website, what people come and look. And most dentists just don't market it effectively anyway. And also remember your personal finances. Cash is king. I wrote a book just this last year. It's called the Dentist Money Guide to Personal and Financial Freedom. And basically, I tell you know, doctors that the fastest way to become rich is to pay off debt, because you're making over 100% return on your money guarantee without risk. And there's a lot of things in that book that help people get out of debt, even those with, you know, credit cards. Oh, well, not credit cards, but like school loans and things like that, and credit cards, of course. But kind of helps people get a game plan. Also, I talk about things that you can do in your practice to make you much more profitable. And also, I mentioned different coaches that I've worked with in the past in the book. There's an Audible about it also, but it's a book that I wrote, and I'm not going to try to sell the book here. You know, I do make $3 on every one I sell though. So it's kind of the big bucks. So really, you know, you have an opportunity. And if we can get back and organize the ways things right, you could even maybe increase your production this year. I mean, if we can bring back those patients, make them feel safe and secure. these are some of the links that I will send you. I'll send you a Word document. This is a great link by Burkhart on scripting, patient scripting for your team, and how to basically start opening your office. For those that are opening your office, I'm very close to my general practitioners, my friends, and one of my Dr. Taliber said, this is really good. I looked at it, I said, wow, that's great. This is the link to Dr. TROELTZCH article, and you just click that and you can watch the video. This is comparing N95 mask with level 3, shows you the difference. It's a really good article and shows how they did different research on it. This is how to create, so like a 2-minute video on how to create a much more fitting mask with the level 3 mask. The next thing is, here's the link to All-Star Dental Academy. They've been putting on a lot of great video programs like the patient journey or, case acceptance. Now, what do we say, so to bring teams back. And so these are the links to that. They also did an incredible little handout, well, it's like 40-page roadmap to recovery, and it's all free. And so I would, grab those links. I think the Cedar Solutions is another thing as far as employees, and I have a link to that also. And this is just kind of fun. eAssist, there are people that kind of help you with collections and things like this, but they created a questionnaire, a test that it's a test, and you go through like 30 some questions about cleanliness in your office. And if you just say yes, you pass. Don't worry about it. They're all questions, but it's a great little deal that you can sit down with your team, kind of go through. And this here is the link, that you put out there to go to it. And that also will be in your handout, so that, and then it's kind of neat to show your patients, well, we're COVID-19 cleanliness certified, and we have a little certificate here, and you can share that with them. Other than that, I think we've kind of run through that pretty quickly. There's so many things to talk about. I hope that I've kind of helped you with some of these questions. But maybe what we need to do now is I'll just come back here. I'll stop the program. And then if we have any questions there, Paul, that people have asked.
Not yet, Ace. I just entered in the chat box asking people to enter in their questions.
Right. See, I was looking at a few before that you had sent me about how do you approach staff or patients who are not taking COVID-19 risks seriously? Well, I think these are the things we have to do. We all wear masks and gloves. We give patients masks. When we ask them, and I don't think there will be a difficulty with it. But, patients should, our team must realize that we have been safe in the past. And it is proven by how many things do people ever get sick from, like the flu or whatever, in people that work in our office. Very rarely that happens. So, we talked about dealing with aerosol, social distancing. I'll tell you, you're sitting in the chair. The social distancing is out the window on that one, of course, but wear masks and we have shields and all that, so that actually we're pretty well protective. I think there's been such a big scare out there. Let's see. You can also put a hairnet on. If I had hair, I'd probably do it, I guess. See, what kind of treatments should be avoided doing? Well, surgical treatment sometimes might be one thing, especially when I'm doing apical surgery. There is more blood and things in the air, but it is amazing how well those high-speed evacs eliminate that whole deal. Right now, I'm not concerned at all about any of the procedures we do in dentistry, and and I've been working with endodontists that have been back, doing emergency care ever since the pandemic began. And No, not one of our people I've worked with has had, or their team has had any problems during this process.
Ace, we have a question from Dick, and I'm not a dentist, so I'm sure I'm going to mispronounce this, but Dick wants to know, Ace, do you ever get patients tested for COVID if you are doing an apiectomy or similar invasive surgery?
No, I mean, basically, we're going to treat them all the same. And that the apiectomy is, which I just talked about. No, I mean, I have no problem with that. I could also put a rubber dam on, make a slice under the rubber dam and go in and lay the flap back. It's not a big deal. Surgeons are doing this all the time. And it's kind of funny in our area. I mean, we have an area of around 300,000 around Olympia. Down Olympia is only 50,000, but the oral surgeons are, have been treating patients routinely. But amazing, the hospital had only, I think, less than 50 cases, over this period of time. I mean, the area is pretty well safe, and just another reminder that what we're doing works, okay, and has been proven over the years we've been in dentistry, and if you really are fearful, you shouldn't really be working. I mean, if it's that much. Now, if it's surgery and you feel safer and you still no, I'm just going to do restorative with rubber dam, I think that's great. And that rubber dam will actually prevent a lot of things from the mouth getting out there. And surgery can always refer out if you feel uncomfortable, but I do not feel uncomfortable doing surgery.
Great. Ace, our next question comes from Y. Wang. A local clinic I know started seeing a patient and the DA found out they tested positive. Is there any protocol for informing or not informing the patient?
I think who tested positive? The patient?
The patient, it looks like, yeah.
So the patient.
I'm sorry, no, the dental assistant found out that they were positive.
Okay, well, and I would hope I don't think they got it. If any one of your team members is positive, fortunately, there's plenty of testing out there. Basically, you would do a antibody test and a COVID test on each one of your team members. If they're I think if they all are tested non-positive, I think you can continue through your process of doing that. But if there was a patient that tested, assistant that tested positive, then I definitely think you'd probably have to connect to those patients that they were in contact with.
Yeah, so I think the question is if the dental assistant finds out they were positive, treated patients, then does the office have a responsibility to call the patient?
I agree. I know that's what I'm saying. If the dental assistant was tested positive, it is our obligation to call the patients that person. Now, and what we were doing earlier in the process is we had two teams. One team would come in on Monday, another team would come in on Tuesday. So if someone actually tested positive, that team would be out, until quarantine. But now, because we have testing, I think it's you can go back and you might want to quarantine them for a few days after they tested negative. But after that, I think they're fine to go back. Now, don't forget, I'm a dentist. What do I know about this stuff, right? Talk to your doctors. But that's a good question. That will come up, by the way.
Great. Just a question: are you going to include why you are safe in our office in your resources?
Yes, I'm gonna give you that Word document.
Great, and we will send that to everyone who completes the survey to get your CE credit and include.
They're being tough on you guys, aren't they? My God.
We are. It's so important that you fill out that survey and give us your email. That's the only way that we'll know to be able to give you CE credit. I did not mention at the start of this that we are still working remotely for the most part at Case Western, and so we don't have access to our usual office equipment. So everything is done via email.
Great. That's even better. It gets there quicker.
Great. And an old friend, Dr. Mickle, says it's good to see you, Ace. So,
oh, us young guys, right? What the heck? Exactly. Looking good.
I'm just making sure that we're not missing any questions here. I think I'm in pretty good shape. Ace, I know we had a question that was submitted by a recent graduate who is less concerned about opening their office because they're they're not in the position to have their own office, but they're concerned about their student debt payment and how this is going to impact their ability to pay that off since they're not working. So,
well, actually, the most, if it's done through the government, that student debt payment is kind of put off to the side and doesn't charge. They don't, to my understanding, they will not charge interest, and you don't have to pay it back, start paying it back until the beginning of this next year, to my understanding. If it was, if the loan was through the government, when they got that. One thing that we need to remind everyone that has student loans, it's not a 7% loan or whatever. But in my book, I talk about this. But if you have a 7% loan and you have $300,000 in debt, you will actually be paying, each month $2,200, and the only thing that pays off that loan, basically $23,000 will go to interest, and only $2,500 will go to pay the loan off. That's a 7.9% loan. And so it's terrible. So if you like to make $23,000, which you had to actually earn 30, pay tax on it to get to $23,000, pay another $2,500 on the loan, and you eliminated 1 year of the loan. Isn't that great? You just made 1,000% returning money, the best way to make money. The key, of course, any student out there, once you graduate, focus on that debt. The first thing you do is go to some company like SoFi or one of them, get that loan down once you have a job to maybe 3.5%. That would be the first thing. You'll save thousands and thousands of dollars in interest that you're going to be paying. And that's also, I mentioned in my book, on how to go through that process.
Good. Another question here that we received earlier, we have a question about very, very high risk patients or elderly patients. Is it worth it to encourage them to not come in for treatment, or is it okay using the methods that you've described to still treat them? Very high risk or very elderly patients?
Well, not too many are older than I am anyway, but it's amazing because endodontics is usually of elderly patients. We have a lot of older patients. That's why I play the oldies music. And in reality, if they can come in and they feel healthy, it's really a choice to them. I mean, I believe we're very safe in our procedures and the way, but what is worse? Having through a patient that has an infection in their jawbone that can actually transmit through the body. That is almost as bad sometimes as a heart condition, sometimes with, things that can happen when you get this, this infection. So it's in their best interest to actually come in. I think most of the general dentists that I work with, are treating patients all alike. And I think I personally just don't know. I'm not, I'm just going with what I've seen and what I've read, that we're actually fairly safe to come into. One of the, I think the German doctor was saying that he knew a dentist in Wuhan, China, and they routinely wore, of course, masks and gloves as they normally do, but they were not getting sick, but the physicians were, maybe because they initially weren't wearing masks.
Interesting. We have a question from Craig Weinstein. ACE, for doctors considering buying a practice of a doctor who may not want to return post-COVID, how would you value that practice for an older doctor who has closed his doors for the past 9 weeks? So again, for doctors considering buying a practice of someone who's not going to return to the office after being closed for 9 weeks, how would you value that practice?
Well, it's a great advantage to the person that's the buyer. Well, first of all, it's not like the doctor office shut down, right? And all offices were shut down. So there is pinned up demand in there. When you do buy the practice, you definitely want that doctor to introduce them to your patients, or at least a letter out there. I've known doctors that leave their office and the new doctor comes in, and then, through a letter, that's how they're introduced. remember, the equipment is one thing, the value of the equipment. You can negotiate, and however it feels. You probably, I mean, you could probably negotiate a better deal, is what I'm saying. And it's probably worth doing that. But you haven't lost much because none of the other offices have been open either. It's not like the doctor just left and let them sit there for 8 weeks because everyone has. So I think you could probably get a pretty good deal on that practice. And if it's practice you want, it's a good way to start because there is pinned up demand.
Yeah,
and I do believe we will get through this.
Dr. Weinstein says that he actually just totally shut down completely. So
Yes.
it's been, totally dark. So.
Well, it's a lot of offices shut down completely also.
Yeah.
But
we have a international audience with us tonight. So even though we're opening up here in Ohio, I know that we've got some folks in Massachusetts and Pennsylvania who said they're still only going in for emergencies. I know there are others across the country who are similar. So I think we have all levels of opening, some not yet even open in unknown.
Well, that's why some of those things from Burkhart will be really valuable for you that are planning to open up. I think, and they have actually a great website too that covers a lot of these things. Now's the time to do your homework.
Absolutely. So unless we have any additional questions, we're going to wrap things up with just a few things. First of all, let me say again, thank you so much, Dr. Goerig. You are a fantastic representation of the school and a wonderful alumnus. We thank you for all that you've done, not only tonight, but really for decades prior. You are one of our favorites. Your student and residents, they love to have you come back. And when we're back open, I know we'll have you come back and speak again. Just a few housekeeping things. I'll tell you again, please fill out your survey and give us your email. You will not be able to get continuing education unless you complete that survey and give us your email address. We don't have
all the handouts.
Yes, exactly. And we will also send the handouts with the CE certificate for you. If you've not yet joined our alumni Facebook and LinkedIn groups, we encourage you to do that. It's a great place to network. And finally, we do have 2 additional CEs coming up, both free. You can find out about those on our website, case.edu/dental. We have a grand rounds coming up at the end of May, and then a oral surgery, oral maxillofacial surgery presentation on cleft palates in June. So with that, Dr. Goerig, I hope you have a wonderful evening out in Washington.
I will.
We haven't kept you from your dinner too long, I think. It's not quite dinner time.
Actually, I have a meeting right after this with my coaching clients, so I'm ready to go.
And in your resources, we will also send you ACE's website, which has information on his offerings in addition to the 2 books that he recommended. We did give all the students the book that you provided, and that was a big hit. So again, thank you, everyone. Have a great night, and please fill out the survey. We're interested to see if you'd like us to do more of these in the future. Have a great night, and see you soon.
Thank you.